And welcome back. I'm Mike Berger, your host today for this Ask the Doctor program. And what we would like to do is get right to a question. My question for these gentlemen: what can a pain management doctor do that other doctors can't, or maybe aren't as qualified as you are?
Well, first of all, Mike, you know we're anesthesiologists.
Right.
So all anesthesiologists are focused during our training on putting people to sleep safely, waking them up safely. But in addition, we're also experts at nerve block therapy. And fellowship-trained doctors like us can perform discrete, specific kinds of spinal nerve blocks, very, very specific blocks on special nerves throughout the spine. In addition, we do procedures that involve neurostimulation, such as spinal stimulators. You want to talk about those for a second?
That's a really elegant technique, Mike, whereby we can put electrodes in patients and test the area of the pain, try to map it so we cover the area of pain, and if it's successful and the patient really likes the way it feels, you can implant it. It's like a pacemaker for pain. It's a very non-invasive procedure. The patient goes home the same day.
I admire you guys so much because it's almost like this, the body is a giant jigsaw puzzle, and you just kind of work with different pieces, and pretty soon it starts to fall in place.
Very much so. It's really fun. It's really fun to take someone who's suffering and have them say, "You really made a difference in my life."
Sounds good. We have a question from Ricky, who is calling from Azle. Ricky?
I'm not a believer in drugs, and I'm wondering what the benefits might be of alternative therapies like yoga or acupuncture to treat my chronic pain syndrome.
Well, I'll take that one on because that's an interest of mine. There are actually many ways to treat pain, and I agree with him that you don't need to necessarily take powerful painkillers to get relief. There's a lot of alternative therapies, nutritional therapies, functional activities, ways to restore function. Sometimes medications can be helpful, but they aren't the whole answer.
Right.
So you gentlemen really look at this from a multi-pronged attack to what can we do to help this patient?
And really it's integration. We try to integrate their activities, their lifestyle, medications if necessary, and if ethical, we will provide them with long-term medications.
Now, we've talked about a lot of things today. We've covered a tremendous amount of ground. Is there anything that you would like to talk about that maybe we haven't touched on?
I think only just the fact that it's very important when a patient's seeking a pain doctor that they make sure that it's someone that's done a fellowship and is board certified. That's very important because there actually are different kinds of boards, and it's very important that you do your homework.
I've had a fabulous time today. I've learned so much, and I hope our audience has as well, because you guys come across wonderfully, and I'm sure you do fantastic work.
Thank you.
So I would like to thank Drs. Robert Bolger and Dr. Renaud Rodrigue from the Southwest Pain Group for joining us today. And remember, even though the show's over, your phone calls will still be answered. All you have to do is call 1-888-572-4411. And you can also visit the website at www.southwestpaingroup.com/askthedoctor. I'm Mike Berger. We'll see you next time.
This program is sponsored by Southwest Pain Group and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.